nurse since 1990 and a neonatal nurse practitioner for about 24 years. I attended the University of Texas Health Science Center. I received my master's, and I'm currently working on my Doctorate of Nursing Practice from Baylor University.
How did you get into the field of medicine, and were you inspired by a woman?
This is a two-part question that I will answer. First, when I was early on in my undergraduate, I went into college not knowing what I wanted to do. And so I had a niece that was born in 1987, and she was born with single ventricle. And so my first visit into a neonatal intensive care unit was overwhelming, but yet fascinating. Seeing a tiny little baby, helpless, hooked up to all these wires and tubes, and I just wanted to learn about the field of neonatology. And actually had never heard of the word neonatology at that point. So I applied to nursing school, got my bachelor's degree, and going back to that visit into the neonatal intensive care unit was also my first introduction to the nurse practitioner role. I remember standing there overwhelmed, and a nurse practitioner came up to me and she asked me, "Do you have any questions?" I was with my brother at the time, of course. And I didn't even know what to ask. But she was so welcoming and compassionate that I thought, I want to do this. I want to help families get through the most stressful time in their lives. And so she was, I don't remember her name, but I know she was a nurse practitioner, and she was just very, very compassionate.
What do you think it means to be a woman in healthcare today?
I think being a woman in healthcare is powerful. I think there has been so many changes over the years as far as the number of women in healthcare. It has grown exponentially as far as the nurse practitioner role, women in healthcare as far as nursing. In 2007, there was approximately 120,000 nurse practitioners, but the majority of them were women. And then years later, 2018, we see that number has more than doubled to over 270,000 nurse practitioners, but the majority of them are women. So that, to me, is powerful.
What are some of the challenges of being a woman in your specialty and just the healthcare field in general?
I think being a woman in healthcare, the challenges of this, and especially probably in my field, is the demand of, well, number one, at work, the demand that's put on you. You have to be a multitasker. You have people coming up to you and asking you questions, and learning how to prioritize is probably one of the most challenging things that I encountered becoming a nurse practitioner, and also, I guess, a woman in healthcare. And then number two, I think the emotional strain that comes with being in healthcare, and I think so more so with being a woman, because we have that maternal instinct, especially in my field of neonatology. We get involved, we get emotional, we cry, but we have to learn how to step back and leave that at work, and then come home and reflect and think and look out for ourselves at home. But I think those are the two most challenging things that I have seen in my career over the past 24 years.
On that note, what are some of the positives that come from being a woman in medicine?
I think the positives of being a woman in medicine is leadership. We learn how to lead. I remember when I first started 24 years ago, shy young girl from a small South Texas town, not knowing how to lead. But as I grew in my career, I think that has been one of the most important things that I have encountered is learning how to lead, how to present yourself, how to get everybody involved in healthcare, as far as nursing, physicians, families. working as a team.
What advice do you have for women who are currently pursuing a career in medicine?
My advice to women, if they want to go into medicine, whether a medical degree, nursing degree, is continue your education. Don't stop just, and I'm going to focus more on nursing, is don't stop at your bachelor's degree. Don't stop at your master's degree. Go back for that doctorate degree. It took me many years to come back to school. I was very scared, hesitant, but I think that going forward in my career has made me a better leader, a better advocate for my practice and for my role as a nurse practitioner. So I say to nurses and nurse practitioners, go for the best, go for your doctorate degree. And it's doable. Everything nowadays is online and it's doable. The other advice I would do is once you get your education, don't keep it to yourself. Don't keep that knowledge to yourself. Pass that information, pass that knowledge on to the novice nurse, to the novice nurse practitioner, to the novice resident, because knowledge is power. And then the other thing is say yes to the opportunity. Don't give up. If you have that chance where you can become a nurse manager, a nurse leader, a lead nurse practitioner, take that jump. Don't be scared.
How can women clinicians best support fellow women clinicians?
Be an advocate, be their voice, support each other. There's so much that you can do to empower the field of nursing and nurse practitioners. And it takes a village to get to where we want to be in healthcare. The role of the nurse practitioner and women in healthcare has come a long way. And that has been because of the support of women getting together and making a difference in healthcare.
Is there anything else you'd like to add or touch on that we may not have covered?
I think another thing I want to say about something positive about being a woman in healthcare.
Yes.
Is that bond that you build, and I don't know, I probably already said that already, is the bonds that you build with patients, with families. And in my role as a practitioner, it's not necessarily my patient, but it's their families. And you build this bond that for some, you remember them forever. I have patients going back 24 years and they come back and they visit me and they remember me, and it's just so rewarding to see that. Very rewarding.